In this video, you will learn more about intracytoplasmic sperm injection, or ICSI for short. ICSI is a type of artificial reproduction. First off, what is artificial reproduction? Well, artificial reproductive technologies are fertility treatments that can help two parents who want to have a child but are incapable of having one, have one. It is used when one or more of the parents are infertile, or if the parents are physically incapable of having a baby. Both eggs from a female and sperm from a male can be handled, and in some treatments, even embryos are handled. Some of the main artificial reproductive technologies are artificial insemination, or AI for short. Next is in vitro fertilization, or IVF for short. In vitro fertilization also encompasses intracytoplasmic sperm injection. And lastly, gamete intrafallopian transfer, or GIFT for short. Next, ICSI. What is intracytoplasmic sperm injection? ICSI is a specialized form of in vitro fertilization, or IVF. This is used for very severe cases of male factor infertility. ICSI involves the injection of a single sperm put directly into a mature egg. Once it is placed inside the egg, fertilization must still occur. Once the egg is fertilized, however, it is then inserted into the female's uterus. Types of embryo transfers after IVF. First, we have fresh blastocyst embryo transfer. Secondly, frozen embryo or blastocyst transfer, known as FET. Thirdly, we have assisted hatching, or AH. And lastly, fresh embryo transfer. Success rates for ICSI. IVF success rates are on average 70 to 85% success. ICSI is proven to have a higher success rate than conventional IVF because many of the females using ICSI are younger and have a higher quantity and quality of eggs. When patients are having both IVF and ICSI at the same time, the average success rate in 2011 was 88%. And finally, in the States, the average success rate for patients 35 and under is 41%. Next, pros and cons of ICSI. Some pros include that you can have a baby even with severe male infertility issues. You can get pregnant even if you have one of the following: low sperm count, physical blockage, poor sperm motility, which means movement, or morphology, which means shape. If you have tried IVF without success and want to have pregnancy post-vasectomy. Some cons, however, include damage to embryos, as well as the chance of becoming pregnant with multiples, or having your child be born prematurely, which means low birth weight or trouble breathing on its own, and immature lungs may also occur in the baby. The child is also more susceptible to infection, and it doesn't allow weeding out. Lastly, it can also lead to birth defects, sex chromosome abnormalities, Hippospadias Angelman syndrome, and lastly, Beckwith-Wiedemann syndrome. Next, we have societal considerations, impact on society, and ethics and morals of ICSI. There are many societal considerations and ethics and morals surrounding ICSI. However, some of the bigger ones are that there are religious reasons to go against ICSI. For example, the Roman Catholic Church says, "The idea of procreation in any way other than intercourse is a violation of nature." Also, many religions have the objection that The destruction of pre-embryos created during this process should be considered murder because they are living beings. In addition, some also believe that it is wrong to continue the use of these assisted reproductive technologies because they may cause serious harm or birth defects/disabilities for the baby. Some say it's better to be existing rather than not, even with disabilities. However, can that be justified? Lastly, what becomes of the lives of the children who are produced using these technologies? Will these kids be regularly accepted into society, even if they were test tube babies, and not created like everyone else? And to wrap up this video of intracytoplasmic sperm injection, we have interesting facts. First off, ICSI and IVF have a similar percentage of birth defects as babies who are conceived naturally. Secondly, there are 5 main steps in ICSI. First, a sperm sample is taken from the man's semen, or it is surgically removed. Second, the egg is surgically removed from the woman's ovaries. Third, using a tiny needle, one sperm is very carefully injected into an egg, as shown in the picture above. Fourth, after the injection, the fertilized egg is observed throughout its growth. And finally, once normal growth is observed, the embryo will be implanted into the uterus of the woman, where there is a chance for it to grow and develop into a baby. Thanks for listening to our video. We hoped you enjoyed and learned something about ICSI.